advised to talk on this topic as I have completed my basic course in PhD, as I have registered myself for PhD, and I have also completed my basic course in biomedical research. So today's topic is descriptive, analytical, and experimental study designs. Can I stand here? Will it be visible to the online participants as well? So I can roam around. क्या? ठीक. So before planning the study design, the first question that we have to answer is, are we assigning any exposures? Are we making any changes in the treatment plan? क्या हम कोई exposure नया देना चाह रहे हैं to the participants? If no, it is an observational study design. ये हमारा एकदम base table है. We can follow this table and we can very nicely plan our study design. If we are not assigning any exposure and if it is an observational study, the second question that comes to our mind is, are we assigning any comparison group? If we are not assigning any, उस group जिसको हम पढ़ रहे हैं उसका क्या कोई comparator है, कोई comparison group है? If no, then that becomes our descriptive study. If we are assigning any comparison, then it is analytical study. And if at all we are giving any exposure, then it is our experimental study. So today we'll cover our topic in three main headings, that is descriptive study, analytical study, and experimental study. Okay, are we okay till here? So starting with the descriptive study, we have the individual study, that is case report, case series, cross sectional surveys. हमारी फैकल्टी ये सब करती है, हमें सब पता है, स्टूडेंट्स को ये ज्यादा ध्यान रखना है. एंड द पॉपुलेशन studies that are done are ecological studies. So basically the epidemiological studies are divided in descriptive, analytical, and experimental. Then we have in individuals case report, case series, and cross sectional surveys. What are case report? केस रिपोर्ट हम में से बहुत लोगों ने बनाया होगा. इट इज अ डिटेल प्रेजेंटेशन ऑफ अ सिंगल केस. जब हमारे पास कोई सिंगल केस आता है जो कि बहुत ही अनफेमिलियर है, रूटीन है, रेयर है, वी पब्लिश इट एज केस रिपोर्ट. दे आर रेयर मैनिफेस्टेशंस, नॉट ओनली क्लिनिकल सिम्टम्स. ये हमारा कोई रेयर डायग्नोसिस हो सकता है, कोई रेयर इन्वेस्टिगेशन हो सकता है, लैब रिपोर्ट हो सकती है. ऑल दोस कैन बी पब्लिश्ड एज केस रिपोर्ट. So this is an example. Our peer reviewed journals, they have separate section for case reports. This is just an example of case report. Case report publish करने से क्या-क्या फायदे हैं? Our colleagues come to know about the rare manifestations, and if the rare manifestations are occurring more than once, then they can help in generating a hypothesis for some other study plan in future. Then another is case series. Like in case reports, you have one or two cases. In case series, this is a study of larger group of patients. Example, more than 10 with a particular disease. ये जो बहुत common example हम लोग देते हैं case series का, it was the thalidomide exposure that happened, in which the kids were, the thalidomide was given to pregnant females and for the treatment of morning sickness, and the children, the born, they were with seal-like limbs, short limbs, called as phocomelia. तो पहले वो case series बना, gradually it came to notice and then it was studied and gradually the drug was withdrawn. So larger number may allow the investigator to assess the play of chance. Common way of delineating the clinical pictures of the disease, but the major drawback of case series is it suffers from the absence of a comparison group. हमारे पास इसका कोई comparison standard group नहीं है. This was another very famous case series in which homosexuals were studied for the presence of pneumocystis pneumonia. ये केस रिपोर्ट्स और केस सीरीज मैंने ICMR से लिए हैं, in which gradually it was formed, जो बहुत ही रेयर है ये pneumocystis pneumonia, it's a rare manifestation, but it was found commonly in a group of homosexuals, which then gradually led to the invention of HIV and correlation with this disease. Then we come to ecological studies. Ecological studies में we study group as the unit of analysis. इसमें कोई individual का नहीं पढ़ते हैं हम पूरे demographic जैसे है कि इस state में ये common है, या if you are studying it across the country, and if you are studying it international, कौन से country में क्या ज़्यादा हो रहा है. So if you are studying a group, it is ecological study. No individual level information on the distribution of exposure. It relates whether population with high rates of diseases also have high frequency of the suspected exposure. Now coming to cross-sectional surveys. Cross-sectional survey, this is very important, and most of us sometime in our life, if we do any research, most commonly we do cross-sectional surveys only. This is observation of a population at that particular time. That is a cross-section of the population, whatever you want to study. Unit of observation and analysis is the individual in this cross-sectional surveys. सबसे common example जो हमारे पास है cross-sectional surveys का is the census, जो every 10 years होता है, but in it is slightly different because उसमें हम पूरा ही population लेते हैं, तो उसमें हमको पूरा country का population लेते हैं, तो उसमें हमें ये decide नहीं करना है कि कौन आपका sample होगा कौन नहीं होगा, पूरा population आपका उसमें participant है. This collects information about the disease burden. This is also known as prevalence studies. Recruitment of study participation, population and sample size. These are to be calculated, and it will be taught to you in your further classes how to calculate the sample size, validity of epidemiological studies and all. In this, we observe for the presence of one or more outcomes or one or more exposures can be studied in the cross-sectional surveys. What are the uses of the cross-sectional surveys? They estimate the prevalence of disease or their risk factors, distribution of health problem by time, place, and person, set priorities for disease control. They help us in generating hypothesis. आपने cross-section survey में देखा कि शायद ये कुछ किसने स्मोकिंग किया है और स्मोकिंग से लंग कैंसर हुआ है, जो कि हमारा गोल्डन एग्जाम्पल है. बट एट दैट point of time, you can just generate the hypothesis that is your cross-sectional survey. You cannot conclude anything from this hypothesis. Before and after surveys, and you also have iterative cross-sectional surveys. In iterative cross-sectional surveys, we mean the repeated cross-section survey of the same population are done to study and analyze the data. For example, HIV का ट्रेंड अभी इस सिटी में कितना है, फिर थोड़े दिन बाद हम क्रॉस सेक्शनल सर्वे करेंगे और फिर देखेंगे कि HIV का ट्रेंड यहाँ कितना, या ट्यूबरकुलोसिस और एनी अदर फैक्टर. सो दैट इज योर इटरेटिव क्रॉस सेक्शनल सर्वे. Some examples of such surveys are: what is the prevalence of hypertension in a city? How satisfied are patients attending government hospitals? What is the prevalence of physical inactivity among school children? So all these can act as your cross-sectional surveys. The advantages are, जो सबसे ज्यादा हम लोगों के लिए advantageous है, it is less expensive and fairly quick and easy to perform. And these two advantages usually we take in consideration while planning our own research. Limitations, they are not useful to study disease etiology. क्यों हुआ क्या हुआ ये in depth हम इसमें study नहीं कर सकते. They are not suitable for the study of rare diseases also, because you are studying such a large population at the studies. If the disease is rare, then it is not useful. So again, जो हम बचपन से सुन रहे, it is chicken or egg story in the cross-sectional survey, which is the major limitation. Has smoking led to hypertension? Was hypertension started first or smoking started first? ये हमको कभी इसमें पता नहीं चलेगा. Only the old and new prevalent cases, exposure and outcome examined at the same time. Example, obesity or diabetes. अब हमें ये नहीं पता कि obesity पहले हुआ या diabetes पहले हुआ. Cross sectional surveys has this major limitation. Again, referring back to our original, we have discussed the descriptive study where we didn't have any comparison group. And again, recalling that you didn't assign any exposure, so this was observational study. If you're assigning the comparison group, this becomes your analytical study. Remember, you're not giving any exposure, you're just observing, but even in your observation, you have the comparison group. And this analytical study, it depends on the direction. It can be classified as cohort study, case control, and again, cross-sectional study. We say cohort when we start from exposure to outcome, and case control is from outcome to exposure. Cross-sectional, again, you have exposure and outcome at the same time, but in this you have the comparison group. Are we clear up till here to the students, PhD students, if any of them are sitting here? Okay. So in analytical studies, investigator does not assign the exposure, makes careful measurement of patterns of exposure and diseases in population. You have a comparison group and make inferences about exposure and disease. Coming to the first type, that is cohort. Cohort is, we all know it has, this word has its origin from the Roman army, and it is a group of people sharing some common characteristics. For example, अगर आज पैदा हुए बच्चों को हम ले रहे हैं, so they are the birth cohort for today. Design of cohort study, we know we take the population exposed and non-exposed. Then how many from the exposed develop the disease and how many remain non-disease. Similarly, how many from this group non-exposed they develop the disease and how many remain non-disease. The standard example that we have been studying since our MBBS days is exposure, that is smoking, outcome is your CVD. So how many smokers develop CVD in this time period? And accordingly, the relative risk is calculated. Types of cohort studies, we have prospective, retrospective, and combination of retrospective and prospective, that is ambispective. Then you also have multiple cohorts, combinational designs, etc. Now, if your study starts before giving the exposure, it is prospective, and you're following the cohort for the entire duration of time, from exposure till the outcome. This is prospective. If your study has started and study has started after the person has been exposed and you are following the person till the occurrence of the disease, this is ambispective. And if your study starts when both the exposure and disease have already occurred, is your retrospective cohort. Again, the golden example, this was somewhere in 1940s or 50s Framingham Heart Study. The objectives were to identify the risk factors for cardiovascular diseases. So, for example, they have hypertensive, normotensive, and many other parameters were also studied. And the entire cohort from Framingham town, the population was around 28,000. They were studied and compared the incidence of CVD. This was a typical example of the prospective study. This is retrospective study. Aniline dyes, the employees who were working in the dye industry, they were exposed to aniline dyes, and then how many deaths occurred due to bladder tumors was studied all retrospectively. Then you also have closed and open cohort study. For example, victims of Bhopal gas tragedy, ये closed cohort था, इनमें से कोई बाहर cohort के नहीं निकल सकता था. Once cohort is enrolled and follow-up begins, no one can be added. Cohort size always gets smaller over time. In open cohort, members can leave or added in the cohort, for example, in our Framingham study. Coming to the elements of cohort study, we have selection of study population. आपका correct cohort choose करना is very essential. Gathering baseline information, follow-up, and then analysis of your data. Selection of study population, they can be general population, cohort, or a subset, like we had in Framingham and nurses health study. Nurses health study was related to consumption of contraception and development of breast cancer. जो भी contraceptives, oral contraceptive pills and development of breast cancer. Special exposure cohorts can be like some occupational group. आपने कोई occupation लिया and you are studying whether the person is having any disease, do they develop any disease or some kind of manifestation. So the sources of your baseline information can be the existing records. You can have some interviews, examinations, measurement of environment, for example, air pollution, exposure to radiation. कितना pollution से अगर हम daily expose हो रहे हैं over a period of time, you choose that cohort and if they develop some disease, illness or not. Then in this comparison group can be internal comparison group, जो उन पॉपुलेशन में से ही अनएक्सपोज पर्सन है, जैसे हमने अभी स्मोकिंग का देखा, उनमें से जो अनएक्सपोज्ड है they will have your internal comparison group. But in some cohorts, finding an internal comparison group is not possible, where you then select external comparison group. For example, observed number of bladder cancer deaths in aniline dye, इसमें सब लोग ही exposed थे, then they were compared with the expected cases. Follow up, then you have to regularly follow up the cohort, uniform and complete follow up of all cohort members. So this we have to know before starting the study. At the start of the study, we have to know our exposed and unexposed population. So amongst the exposed, those who develop the disease is A, and those who don't develop, they are B. Amongst the unexposed group, C will be diseased and D will be non-diseased. So you have to know this A plus D and C plus D at the start of the study. Then we calculate the relative risk. So this in this relative risk we know, ये calculation community medicine हमको second year से पढ़ा रहे थे और करवाते थे practice, जो बड़ा तब difficult लगता था, but today when I am teaching you, now probably I have learned better. Interpreting relative risk, we all know if the relative risk is more than 1, it has the incidence is exposed is higher than in unexposed. Agar if it is equal to 1, it is the same, and if it is less than 1, probably it is negatively associated. What are the strengths and weakness? The strength of cohort studies allows calculation of incidence, examine multiple outcomes for a given exposure. There is very much clear temporal sequence that we can study in cohort. Good for investigating rare exposures. अगर कुछ rare exposures है तो cohort study design is a good way to work. Weakness is we may have to follow large number of subjects for a long time, and that is why it makes it very expensive and time consuming. It is not good for rare disease, not good for diseases with a long latency, and of course we have loss of follow-up, which can introduce the bias in the study. Coming to the second, ये cohort study हुआ. Now the second is case control study. Case control study, again we have this golden old example of Doll and Hill from 1952, in which the exposed were the smoking, some were non-exposed, and how many of them developed lung cancer. So we study this from outcome to exposure. For the case control study, we have to know this at the start of the study. Who are your cases and who are your controls? And what we calculate is odds ratio. Odds ratio is AD by BC. Interpreting odds ratio, we all know odds ratio, if it is more than 1, the exposure is positively associated with the disease. It is similar as that of relative risk. But the concept and the performing of case control is exactly opposite to that of cohort. In case control, strengths and weakness, you have, it is good for examining rare outcomes or outcomes with long latency, relatively quick to conduct, it is inexpensive, it requires comparatively few subjects, and multiple exposures or risk factors can be examined. The weakness is, it is very much susceptible to recall bias, क्योंकि basically आप आउटकम से एक्सपोजर पे जा रहे हैं तो रिकॉल बायस इसमें हो सकता है. सिलेक्शन ऑफ एन अप्रोप्रिएट कंपैरिजन ग्रुप में बी डिफिकल्ट. जो कंपैरिजन ग्रुप इसमें हमें सिलेक्ट करना होता है, इट हैज टू बी वेरी मच सिमिलर बट दे हैव टू बी नॉन. Rates of disease in exposed and non-unexposed individuals cannot be determined. ये क्वेश्चन मेरे माइंड में हमेशा आता था जब भी मैं स्टडी डिजाइन्स पढ़ती थी, इसलिए मैंने आज इसका बहुत ही क्लियर कट एक स्लाइड डाल दिया. हाउ इज रेट्रोस्पेक्टिव कोहॉर्ट स्टडी डिफरेंट फ्रॉम केस कंट्रोल? सो केस कंट्रोल स्टडी, it goes from effect to cause, that is outcome to exposure, and in retrospective cohort it goes from the exposure to the outcome. क्योंकि हम इसको रेट्रोस्पेक्टिव अगर बोल दे कोहॉर्ट को तो ये एक हमारे दिमाग में कंफ्यूजन रहता है. नाउ कमिंग टू द थर्ड पार्ट, दैट इज एक्सपेरिमेंटल स्टडी. तो हमने ये डिस्क्रिप्टिव स्टडी और एनालिटिकल स्टडी कर लिया. नाउ वी कम टू द थर्ड, दैट इज एक्सपेरिमेंटल स्टडी. इन एक्सपेरिमेंटल स्टडी, व्हेन द इन्वेस्टिगेटर इज manipulating the treatment or manipulating the patient in any way, we call it as experimental study. They are also called as clinical trials when it is done in clinical scenario. Clinical trials, they translate result of basic scientific research into better ways to prevent, diagnose, or treat the disease. Research studies involving people are designed to answer scientific questions and find better ways to prevent, diagnose, or treat the disease. These are also called, they are randomized or non-randomized. Randomized controlled clinical trials, they are a planned experiment. It is pre-planned, designed to assess कोई भी नई चीज है, डायग्नोसिस है, ट्रीटमेंट है, कोई दवाई है, प्रोस्थेसिस है, इन्वेस्टिगेशन है, कोई भी नई चीज अगर आप ट्रायल करना चाहते हैं, इट हैज टू बी randomized controlled clinical trial. It essentially involves comparing the outcome in a group of patients treated with a test treatment. जो भी आपका स्टैंडर्ड ट्रीटमेंट है उसके साथ हम कंपेयर करेंगे with those observed in a comparable group of patients receiving a control treatment where patients in both the groups are enrolled in a prospective study and they are followed over the same period. What are the objectives of these clinical trials? The clinical trials are normally conducted to evaluate new forms of therapy or prevention methods such as new drugs or treatment. कोई भी नई दवाई है, नया हेल्थ केयर टेक्नोलॉजी है, कुछ नया डिलीवरी सिस्टम है, कुछ नया टाइप से ऑर्गेनाइजेशन स्टार्ट किया है, new programs of screening or even early detection, anything can be studied in clinical trial. And I'm very happy to also share with you all that we are soon going to start a clinical pharmacology unit in which we have already got approval from our ethics committee for 2 trials, and we have already started 2 trials. Basic steps in conducting randomized controlled trial. You have to first draw up a protocol. Protocol designing is very, very tasking in this randomized controlled trial. We have to select reference and experimental population. Randomization is one of the very critical steps in designing this randomized clinical trial. Manipulation or intervention, आप कैसे intervention देंगे, क्या देंगे, follow up and assessment of outcome. Randomization word से क्या मतलब है हमारा? Randomization, it ensures that each participant has an equal chance to be assigned in one of the 2 or more groups. कोई नई दवाई आई है और अगर इंक्लूजन और एक्सक्लूजन क्राइटेरिया में आपका पेशेंट इंक्लूड हो रहा है तो आप वो पेशेंट को इक्वल चांस देंगे कि वो कोई भी आर्म, जैसे मान लीजिए एक स्टैंडर्ड ट्रीटमेंट है, एक नया है, तो कौन से आर्म में पेशेंट रहेगा, पेशेंट शुड गेट अ इक्वल चांस. How will the patient get equal chance? For that, the patient should also not know, the treating doctor or the person in charge should also not know in which arm the patient will lie. तो अभी हम उसको कहते हैं ब्लाइंडिंग, सिंगल ब्लाइंडिंग. सिंगल ब्लाइंडिंग में ये होता है कि पेशेंट को नहीं पता कि उसको दवाई मिल रही है नई वाली या स्टैंडर्ड ट्रीटमेंट मिल रहा है. अगर डबल ब्लाइंडेड है तो पेशेंट को भी नहीं पता और इन्वेस्टिगेटर को भी नहीं पता है. Triple blinding में even the person who's allotting does not know. And also there is quadruple blinding जिसमें data analyst and the person who's sending the drug and allotting will not know. So they are quadruple blinding के level तक अगर हम उसको कर सकते हैं ethically, so they can be very nicely the randomization and the blinding can be done in that. Randomization provides the best way to prove the effectiveness of a new agent or intervention by ensuring that all groups are as similar as possible. Of course, there will be some confounding factors, some co-interventions and bias. They have to be minimized in such trials. The comparison groups in an experimental study can be therapy versus no therapy. एक group को आप दवाई दे रहे हो, एक को आप नहीं दे रहे हो. There can be therapy versus placebo. Placebo सबको पता है, it is an inert substance which will not do anything to the patient. But इस पे बहुत ethical issues अभी आ गए हैं because people say by giving placebo you are doing harm. So it is very controversial and not very accepted. But in some trials they do get some exemptions for this and होता है प्लेसेबो ट्रायल्स भी. एंड देन देयर आर थेरेपी ए वर्सेस थेरेपी बी. मोस्टली वी गो फॉर दिस थेरेपी ए वर्सेस जो एक स्टैंडर्ड ट्रीटमेंट है वो दो, थेरेपी ए थेरेपी बी में आप अपना नया ड्रग ट्राई कर सकते हैं. The study designs, they can be some parallel treatment or simple non crossover. Crossover में planned crossover है. पहले हम ग्रुप ए को ए ट्रीटमेंट देंगे, ग्रुप बी को बी, फिर ग्रुप ए को बी ट्रीटमेंट देंगे और ग्रुप बी को ए. दिस इज क्रॉसओवर डिजाइन. Factorial and cluster designs. These are all the different designs of randomized trial. The concept of blinding, we have already discussed. Single blinding, patient or in some trials, the physician is blinded, but the patient knows. But such trials have been later on been very controversial and उनका efficacy और उनका publication फिर release नहीं किया गया था. So in single blinding, usually we say that the patient is blinded. Double blinding, patient and the investigator both are blinded. Triple blinding, even the trial administrator is blinded, and in quadruple, even the data analyst will be blinded. Blinded of what treatment has been received from which patient. These are different phases of clinical trials. Clinical trials phase 1, 2, 3, 4 में होता है. 1 में हम healthy volunteers को देते हैं up to 50, in which only safety and acceptability has been studied. In phase 2, 100 to 50, in which long-term safety, dose schedule, and early indications of efficacy are studied. In phase 3, we go from 1,000 and more, and in this we take high-risk patients. इसमें हम effectiveness देखते हैं, and phase 4 is nothing but our post-marketing surveillance. These are few examples of a therapeutic trial to study if a new drug regimen effectively lowers the viral load and improves CD4 count in HIV infected persons compared to HAART, that is highly active antiretroviral therapy, जो आजकल बहुत commonly हम HIV patients को देते हैं. इसमें यह है identify the HIV infected persons, define inclusion and exclusion criteria. You randomize patients into two groups. One receives the new drug regimen and the other HAART. Follow up periodically. Use statistical methods to see if there are any differences, and only if it is statistically significant, we count on the new treatment as effective. This is another example of a prevention trial in which a new vaccine has been developed that has generated laboratory and animal data supporting its safety and ability to generate immune response. There are some advantages and disadvantages of RCTs as well as we have for all the other study designs. This is the only effective method known to control selection bias. Controls confounding bias without adjustment. It facilitates effective blinding in some trials and maintains advantages of cohort studies. Disadvantages, it may be very complex and expensive. It lacks representativeness because you cannot experiment on anybody. The person has to be informed about each and everything, and the consent is to be taken. So basically the person volunteers if the person is participating in RCT. The ethical challenges are immense when you are going ahead with any kind of RCT. So again, coming back to the table, I think we have covered all the three main study designs and the methods of sample collection, analysis, and all will be taught to you in subsequent classes. So this was all from my side. Thank you. Any questions?
Hello. Madam, if any drug,
Yes. Yes, sir.
any drug or any reagent or any device made first time where there is no standard therapy available. So in which design it will go?
So first we start with the animal models then. So we go with the preclinical. Preclinical का भी एक बहुत बड़ा साइंटिफिक एविडेंस है इसमें, जिसमें हम पहले बहुत कम डोजेस में फिर मैक्सिमम टॉलरेटेड डोजेस, एंड वी हैव वेरी गुड एनिमल मॉडल्स in which the dose of which is given to the animal, how it is to be extrapolated in the human, and 1,000th of that dose is tried in a healthy volunteer first, and then gradually we proceed with different phases of clinical trials.
So in that case, it won't have a control group.
No, it
Means
won't have
a
control
comparative.
group in the beginning, but then later on we can, so once it is established, then we can place it in the control group and we can study accordingly.
A study,
Yes.
then males to males or age
Yes.
group. And it's not possible to have two comparison groups with all the parameters equivalent.
Right, ma'am.
Then also you'll call it comparison group if the other parameters
But we
are
have, that is one of the difficult challenge, but we have to overcome that. If we are having a control group, we have to have it as similar as possible to the test group, and they have different methods to select the comparison group also.
Dr. Pooja, it was very good. I just wanted to answer sir's question. Sir, Amit Verma sir's question, sir. Sir, it is not always required that you start from phase 0 of any trial, because it is not possible कि आप कुछ intervention कर रहे हैं. Just like if you are doing it, some nasal mask, you cannot apply it over a animal and do it. For that, you have to start from descriptive study, generate a hypothesis if there is no hypothesis, and then you go to analytical study design. Ideally, have a comparison group, then you test that hypothesis. Then you can go and tell, yes, now I can go for some phase trial.
But didn't he ask about a drug specifically? So if it's a drug,
Yes.
you can apply it on mammals, can't you?
Yeah, yes, you
Yeah,
can,
he
but not
specifically
always.
asked for drug.
But not always we start from animals, madam. It is like
Even for drugs?
even for drugs, it is not always. You can have some.
Are you permitted to start a new absolutely raw drug in a human being
No,
on
no,
the
no,
first time?
no,
That
no.
was
No,
his
no.
question. That was his question. If it's something like a clinical trial, but then it has to be done
I
in
thought he-
experimental animals, right? Amit? That's what you asked.
Sir, did you ask only about the drugs?
Yes.
Okay.
Yeah, chemical.
Some methods even he said.
Methods.
So I was talking about the methods part, sir. Not only that.
But yes, rightly told by Dr. Harshal, if we are, for example, starting with some behavioral, psychological models, so most of the models, they are, we do have animal models, but some philosophical studies and psycho-behavioral studies, that we can start with some evidence like qualitative methods, interview, focus group discussions. And
If there is a new drug, so we can do also the in silico study before the starting.
Yes, yes.
sorry, sir?
In silico study we can do because the
Yes, in
all the
silico molecular
yeah,
studies, yes.
in silico study, ma'am.
Yes. So in vitro and in silico, these studies are to be done before
Because it is a
extrapolating
new
them to
drug,
human.
so we can make the molecular structure and for the new drugs and for the
Yes.
disease, and we can do the docking also with the help of the software.
Any other inputs from any member?
Thank you, ma'am, for your
Thank you so
valuable
much.
knowledge.
Thank you.
Now I would like to request Dr. Jyoti Bindal, madam, to present sapling to Pooja, madam, as a token of appreciation. Now I would like to request Dr. Anand Mishra, sir, to present certificate to Dr. Pooja ma'am.